Hello and welcome to my comprehensive parent guide for children with high-functioning autism spectrum disorder. I'm Dr. Deborah Pontillo. I'm a pediatric psychologist, and I'm also a specialist in child development, behavior, and learning. And I'm in private practice here in San Diego, California. I'm also voluntary assistant clinical professor in the Department of Psychiatry in the School of Medicine at University of California, San Diego. And I'm extremely excited to get this package out to parents and caregivers, family members, and educators to work with these exceptional kids. And I will be adding modules, topics to this program continually. If you have an idea or there's something that's not addressed currently and you would like to suggest a topic, please go to www.howtohelpmychild.com or send me an email, give me a phone call. I welcome your feedback and your questions. I want to make it as succinct and helpful as possible, and also covering as many topics as would be of help to families. So let's get started with the introduction. Basically what I'll be doing is I'm going to give you a framework for understanding your child with autism spectrum disorder. And what I'd like to help you do is to go through some of the common strengths as well as some of the common challenges that kids with autism spectrum disorders often demonstrate, but the goal really is how to understand your particular child in order that you can help maximize their potential. And I use the label autism spectrum disorder because it gets all of us together as a community. It gets parents and educators who are specialized in helping kids like this get together and provide a skill set or some tools for kids who have similar challenges. But after that point, I like to throw away the label of autism because I feel like, it really does not help you when you're really trying to individualize the help that your child needs. Every child with autism spectrum disorder is unique and different, and that's the same if you do not have a diagnosis or if you do have a diagnosis. Everyone's got a different personality. Everyone's got a different family background, cultural background, religious views, interests, and so too strengths and weaknesses. So what I'm going to do is I'm going to help you figure out your child's individual profile and use me as a salad bar, if you will. Look at what the menu that I have and that I'm going to be presenting to you. And, some things may apply, some things may not apply. You may say, well, that's interesting, but that really doesn't affect my child right now, or I'm going to file that away for later. And that's what I want you to do. Only zero in on what you feel is going to be helpful for your child right now, or what help explains your child right now, and then you'll get the most traction with the work that we're going to do. Okay, so here are some common strengths that I see in kids who have some of these developmental challenges. And I start with this because when I'm sitting with a family in a diagnostic assessment and I'm giving them the feedback, I know as a parent, you go to some horrible places of grief and pessimism and worry about your child's future. But let's not forget how exceptional your child is. Many kids with high-functioning autism spectrum disorder have a high IQ. And it doesn't necessarily mean your child's going to be even across the board. Some kids are just exceptionally verbal and articulate, and they have a wonderful vocabulary. They're great talkers. They're great explainers. They use wonderful specialized vocabulary. Other kids, not so much. They might be the more visual spatial thinkers. They think in 3 dimensions. They think in pictures, and these are the engineers of the future. But super smart kids, and really good, and just creative in that way, and passionate. So that's a huge bonus. And for a lot of kids, especially what we see in the early years, in the preschool through 2nd grade years, is exceptional reading skills. These kids can read often, visually decode, and get very fluent at a very young age. That's a wonderful skill to have, that visual decoding and visual fluency ability. Memory. I can say this with confidence that probably your child has an excellent memory. There are different kinds of memory. Some kids are very good auditory memory, storing and retrieving. So, for example, they can remember exactly who said what, or they can remember the dialogue as it gets, and sort of repeat a dialogue from their favorite movie or TV show. Or they can memorize a book that you read them only once or twice and remember what page came next and how it's supposed to go. Some kids have an extraordinary visual memory. They can remember a three-dimensional Lego construction they built 2 weeks ago and reconstruct it. Still other kids have absolute fabulous memories for routines and how things go and remember what comes next. Another part of the reason I'm going through some of these strengths is, you're going to want to use your child's strengths to help bolster some of their areas of weakness. So really pinpointing what they're good at, for example, memory, is going to be an excellent scaffold for teaching some of the other skills that they're weaker at. So we're going to want to pull from their good memory skills, if they're good auditory memory kids or visual memory kids, and help use that to bolster some of their other skills that may be lacking, like social skills or what have you. Visual spatial skills, I already talked about it in a way when I talked about high IQ, but there are a lot of kids who are really good at being mechanical, at being three-dimensional, at being visual perceptual, so seeing puzzles and putting them together, figuring out how things work, how they fit together. I mean, absolutely wonderful. They're going to be great creators of graphic design, computer design, and I mentioned vocabulary as well as being a strength. There are more still. Let's go over some more strengths. Visual problem solving, this comes back to things like puzzles and figuring out when something is broken, how to fix it. Structural design, stereo systems, figuring out how things fit together. Temperamentally, there's a lot of strengths kids like these have. Outgoing. A lot of kids on the mild autism spectrum are really outgoing, and they may lack a little bit of the social decision making and social judgment, but this can be a wonderful strength. An outgoing child is going to be socially motivated and want to interact with other people. An outgoing child is going to take a few more risks, which can be a huge benefit in getting them into novel social situations. So a lot of good things going for a child that is extroverted in that way. Another temperament feature, personality feature that I see a lot in kids with autism spectrum disorders have a wonderful moral code. And although this may be a source of complaints for many parents, my child's fixated on what's fair and who got what, and my sister got this and I didn't get that. It's not fair. It's got to be fair. It's got to be fair. And so, yes, a lot of kids can struggle with the rigidity, but what's nice about it is these often are just really good kids. They want to do well. They learn the rules. They know what's expected of them. And for some kids, they want to abide by those rules. And they are very rule-based kids. And although we like to help those kids be a little bit more flexible in their moral code, gosh, isn't it wonderful when they actually care to abide by the rules of others. A lot of kids on the mild autism spectrum are doing great already in many different areas where they've had specific learning experiences. So I don't want anyone to think that, well, my child, it's black or white, and my child either does or does not have social skills. A lot of really bright kids on the autism spectrum have already shown the benefit from your teaching and your explanation, your guidance, and have learned in specific experiences. And just to give you an example, some kids have been taught, at birthday parties, if you're the host, say thank you and make sure that your guests are taken care of, and don't run the show. Make sure that everyone has a drink first, and a lot. That may be something that your child does really well from that point on. They're just a really great host or hostess in those types of settings, and they are good at that. Or they might be good with really young children. They've learned, to how to be nurturing and kind to a young child or to an animal like a dog or a cat, and be very empathic and caring. And so they've already developed a niche or a sort of specialty in kind of their own social development where they've learned something and they're able to do it very well and get very positive social feedback for that. So, that just is demonstrating again why it's so within their reach to be able to learn more, because they already have done it, and you really may or may not have focused that intently on doing so. There are many, many, many others that I haven't mentioned here, and you may be already thinking about something. Your child's very caring. A lot of kids on the autism spectrum, it doesn't mean they don't care about you or they don't love their family members. I mean, these are kids that are just, they have the sweetest heart and they just really do care, and it's obvious. So, that is just a wonderful strength to have as well. Okay, so what are our common parenting challenges? And, I see a lot of these, behaviors as misunderstood by the general public. These are kids who are often, before they get to me, they're mislabeled. They're mislabeled as being a behavior issue, or just hyperactive kids, or too impulsive, or maybe the parents are inaccurately blamed for not reining the children in as much. But what it really comes down to is that these kids struggle in a variety of different ways, and there are reasons for each of these developmental lags that we are going to address. But we have to really understand why they're occurring and what's underlying them in order that we can build the skills to overcome them. So number one is obviously the behavior, a lot of behavioral challenges, and often underlying behavioral challenges is motivation. This often comes across in the preschool years, not always, but often. Families complaining that kids have a hard time, they're having temper tantrums or they're having outbursts when they don't get their way. Well, we do come to expect that to a certain degree from 2 and 3-year-olds. When it continues through kindergarten, first grade, and beyond, it becomes a quote-unquote behavior challenge. Even getting a child to be motivated sometimes can be a common parenting challenge that goes throughout the school age years. Kids on the autism spectrum can have their own agenda at times, and it may or may not fit with yours. They may be eager to please you in some ways, and in others very motivated by what they care about and the way they see their goals. And so getting them motivated to study something boring, for example, or to drop what they're doing and go do something that you would like them to do. It can often be a source of power struggle and tug of war, just because the motivation is often not intrinsic to the child with ASD. Poor perspective taking is usually a given in some areas, not in all. And usually in areas that are more subtle. So for example, perspective taking, when I'm talking about really, is your child's ability to feel what you're feeling, see signs based on your body or your face or your tone of voice that lets them know, it clues them in to how you're thinking or feeling, or really understanding how their behavior might impact other people's thoughts, feelings, opinions, and what have you. And I don't mean, that they don't understand when a child trips and falls and cries that child has hurt themselves. That is a very obvious sign. But it's often with kids who are bright, it's more subtle cues. Not knowing when other kids are getting slightly irritated with them and not taking that cue. Not knowing that giggling and using foul language might be okay at home with their brother, but out with the teacher in class, it might be taken in a totally different way because the perspective of others has changed. So you get that socially inappropriate behavior. So perspective taking can be subtle and it can be very abstract in some ways, but it really is a part of development that is lagging, that once we address, we see a lot of significant changes for the better. Stubborn and rigid behavior, I think everybody can attest they've seen this in some way or another. So kids often, they're very difficult to budge when they are either arguing a point, or if they are thinking that their way is the right way and you want it to be something different, or they come to expect something a certain way and that's how they want it to be and you're trying to change it, or even if you're trying to get them off of video games to come to the dinner table, just transitioning can be a big challenge. So rigidity can come in many forms, and especially in different ages. It can even be as young as toilet training. Rigid behavior, kids don't always want to be toilet trained when you're ready for them to be toilet trained, and that rigidity and digging in their heels can manifest in that way as well. To some degree, resisting help, resisting teaching, or resisting direction. And this can manifest either at school. Some kids don't like to be told how to draw the letter D differently. They prefer to do it their way, and they get really bent out of shape if someone tries to correct them. They're very hypersensitive to criticism, so they almost feel like if you are telling them that their letter D isn't quite made that way, it's got to be made in a different way, their interpretation is that you're criticizing them. They can have a tendency to overreact, get very frustrated, and kind of push you away. A lot of kids resist help and direction because they're very all or none in their thinking and very perfectionistic. So the idea is that, either I'm doing it right or I'm doing it wrong. And if I'm doing it wrong, I'm not going to do it. And if you're helping or teaching, it means I'm doing it wrong. So that's it, I'm done. And so you get this very on-off switch in terms of getting them to participate and learn and move along. You can't learn unless you accept direction, and yet it's really hard for kids often on the autism spectrum. Now, some kids, older kids, are really good at holding it in, so there may not be any outward signs of it, but then they hold it in for 6 hours a day during school, and then they come home and have a lot of behaviors that parents are then puzzled with. And that can often be the culprit right there. Another parenting challenge that we're going to discuss to some degree is anxiety. I think that goes along with autism spectrum disorder. I think a lot of anxiety is about new things or about things that are different or unique. I'm going to talk to you about the triggers of anxiety and how to manage them. A lot of kids develop very specific fears, fears of the dark, fears of going to the bathroom in certain places. Those are not uncommon either. A lot of kids develop social anxiety, really desperately do not want to be perceived as any different from their peers, and can have almost a huge reaction or panic attack should you need to take them to a speech language therapist or anything like that. I'm not different, I'm not different, I'm not different, I'm the same as my friends. A lot of anxiety, which is hard because that resists the help that you're trying to give them. So we'll talk more about the triggers and how to cope with that as well. Low frustration tolerance and anger outbursts. Like I mentioned before, when something triggers a child, it's not uncommon that they don't have a lot of coping strategies to kind of go with the flow and manage some of their feelings. So some of the parents I talk to can talk to me about, feeling that the child goes from 0 to 60 instantly, and it feels like it's on a dime. And some kids will have anger outbursts. Other kids may withdraw and avoid. So other kids might just, refuse to do something that you're asking them to do that's difficult or challenging. So that can be something, a source of frustration, and something that we'll talk about as well. Poor transitions is commonly seen, it can be seen at home as well as at school. And what I mean by that is shifting gears from one thing to another. So going from outside time to inside time, or playtime to getting ready for bedtime. And it's not that all kids don't have difficulty going from something pleasurable to something unpleasurable. They all do. What I'm just talking about is just harder for these kids somehow to stop their brain from going on where they're going, like a train that's going 90 miles an hour, slow it down and change direction. So there are ways that you can practice this with your child and set the environment up so that transitions become less of an issue, and we'll talk about that too. Black and white thinking. Black and white, everything's extreme. A lot of kids on the autism spectrum are not very gray in their thinking. I'm great at something or I'm horrible at it. My teacher really likes me or they hate me. My friends really like me or they hate me. I did a great job on my paper. I did a horrible job on my paper. This person's nice. That person's mean. So there's a lot of these black and white either or extremes in their viewpoints and in their thinking, which, that's not the way our world is. That's not the way they are. That's not the way others are. And a lot of these misinterpretations that are so extreme can lead to a lot of anxiety and a lot of negative feelings. If you think about it, if your teacher is instructing you and changing how you're writing your letter D, well, it must be because I'm not doing it right. So I'm not good at the letter D. Well, now you've just gotten into this self-deprecating attitude, which is going to prevent you from trying it again another time. Or if you're in a social group and so-and-so didn't invite me to a party. Well, they hate me. They're mean. Well, now you just shut yourself away from a potential invitation in future. I mean, there are many other gray possibilities that could have occurred, and even our good friends sometimes don't invite us to every single social event. So kids who miss the gray area, they do have a lot more frustration, they do have a lot more misinterpretations, and often a lot more social anxiety. Social cues, I think I mentioned this before in terms of perspective taking, but a lot of kids on the autism spectrum really struggle with getting those subtle social cues, knowing when a joke's not funny anymore and you need to stop, knowing when your listener has kind of gotten bored with what you have to say and has trailed off and is not paying attention anymore. Knowing when something you think is funny, maybe someone else doesn't think is funny, maybe someone else feels insulted. So there's lots of little subtle things, and it doesn't mean your child doesn't understand the big emotions in others or doesn't have empathy, but I'm just talking about the subtleties, the unspoken words that we say with our body and our eyes that a child with autism spectrum disorder may not focus on or may not be able to process when they see it. Another common parenting challenge that we're going to talk about is the frustration in the family members, the parents and the siblings. And I think, the siblings are important too, because typically developing siblings do share many of the frustrations the parents do, but they have the added difficulty and challenge of being kids themselves. And they may have, some of their own needs emotionally, developmentally, socially, that may not be able to be met in the same way as if they had a child without developmental challenges, and supporting them too and helping them come to terms with a sibling with challenges and how that affects them, and helping them establish some boundaries for themselves and some time for you and for them, I think is extremely important. So I don't want to leave the siblings out when we talk about parents here. Okay, so as we move forward with the program, your new framework basically for parenting your child. And this is something that I talk with about parents when I leave the office, before I have them leave the office, when I give them the diagnosis of autism spectrum disorder, is I want you to think about your child as having a learning disability. And this may help you in explaining your child's new diagnosis to family members, grandparents, and what have you. I think of it like dyslexia, for example. Dyslexia is a learning disability that affects a child's ability to read, to spell, to write. Your child's learning disability is really affecting their socialization, their social development, and their social communication skills. And as a result of this learning disability or challenge, they're going to need extra help in this area. It's not a mental health disorder. Your child is not, suffering from a mental health condition. They're having a learning challenge. And just like dyslexia, there's tutoring, there's programs, there's support systems out there. But this is something where, lots of kids with dyslexia do great and learn how to read and are able to read and be functional. And so too, your child can be very functional in social environments in the future with the right support and the right teaching. I also want to impress upon you that, because your child has a diagnosis does not mean they can't be taught. But what I am saying is that many of the skills that are intuitive for other kids, that kids just naturally acquire, your child might need to be taught explicitly. So it's not that they're not going to be able to acquire these skills, it's just that you're going to have to be very methodical and explicit in teaching them, whereas if you have another child that's not affected in this way, it might have just naturally occurred. You didn't really have to be so explicit in your teaching. With kids with autism spectrum disorder, repetition and practice is key. So I see a lot of parents who get really, really frustrated. Like, I've told my child 15 times before, don't do that in a social setting. You can't swear, or you can't talk like that, or, be quiet, or knock on the door. I can't remember how many times I've told them. Practice, 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 because kids, all kids need practice, but kids with autism spectrum disorder do need a lot of repetition. Just like a child with dyslexia, don't teach them the alphabet once. Keep working on it. Just keep working on it. Use different contexts, because kids sometimes with autism spectrum disorder, due to their really great memory, they can remember a specific example of something you've taught and be fabulous at it, and you think you're done and you've closed the book. Well, something similar comes up and it doesn't quite translate, and you're thinking to yourself, why didn't they figure that out? And it's because you didn't practice it in that context. Isn't that a different thing? And I'll give you an example. We're talking about the child who you taught to be a great host or hostess at their birthday party. Well, they followed their routine. They said thank you for the gifts. They got everybody cupcakes. They said thank you for coming. Well, now, 3 weeks later, you're having a cocktail party with your friends, and some of your friends bring the kids over, and your child's telling them what they can and can't do and not sharing, and you're having some behavioral challenges. Well, I thought they were so good at being a host. Well, no, you've changed the context slightly, and you didn't prepare them ahead of time that this was going to be similar to that, and that being a host is the same in this context as it is in that context. So helping them learn strategies and skills in different contexts is very important. They will file it away like a filing cabinet. Being specific and concrete, I think, is really important when you're teaching your child a skill. You need to make sure that you're examining the language you use, and that you're being very obvious and specific about what you want your child to do. Kids on the autism spectrum are often not great and understanding abstract things. So, for example, telling a young child to just listen or behave might not tell them exactly what you want from them. So changing your language to, I would like you to please sit down when we go into the office and not lie down because that will make me feel good, is a very specific and concrete request. Just come into the office and behave may or may not get through to that young child. So really being specific and concrete is extremely helpful. Your goals as we make our way through this package are to teach explicitly, concretely, specifically social awareness, how to think with other people's perspectives in mind, how to perceive other people, how to predict how their behavior will impact other people. We're going to be teaching your child how to regulate their emotions better, when they get frustrated, when they get rigid, when they're going to that place where they have this outburst or an anxiety attack, how to help calm themselves down and regulate themselves, and what you can do to foster that. Helping to develop their communication skills. So I don't just mean chatting up and back, although that's a very helpful skill to develop, is how to have a joint conversation, a good speaker and a good listener. But I often mean sometimes even communicating feelings. Communicating thoughts and feelings are very hard for kids, even with great vocabulary. Feelings are tough to talk about and tough to learn how to talk about, but when a child can develop their communication skills in that area, they can often circumvent or get around those outbursts before they happen, or those frustrations. And in general, your goal as a parent when you're talking about what you're going to be working on is, we're going to challenge your child. We're going to take where they're functioning at now. We're going to up the ante a little bit. We're going to set the bar a little bit high for them, but we don't want to set it way too high. And this is where I often come in and correct some goals that other therapists or educators have mistakenly placed a goal too high for a child. And when a child gets overwhelmed, you get a lot of frustration, you get a lot of refusals, you get a lot of behavior, you get a lot of anxiety, and you lose motivation and compliance. And so we don't want to overwhelm. But we also don't want to underwhelm. We don't want to assume, well, because they have this disability, frequent meltdowns that's just what they have to do. No, not necessarily. We want to raise the bar. They don't have to have frequent meltdowns. We just need to give them the skills to be able to overcome them. We're going to look at increasing inflexibility and decreasing rigidity. I talked about that, reducing anxiety. I want to also address school challenges. There can be academic challenges that kids have, especially in the later elementary school age, sort of 4th grade, 5th grade and beyond, in terms of written expression, sometimes reading comprehension, some of the emotional and behavioral challenges that come up at school, and in general, how to maximize your child's potential and celebrate their unique strengths. And this is why I started with it. You really want to enjoy what they do well. Make sure that we're focusing on the challenges, but we're really thrilled and enjoying them for who they are and the wonderful strengths that they possess. So the big picture, we're also going to look forward into the future at education, at school choice. We're going to talk about school services like individualized educational plans and some of the specifics, classroom size, types of schools available, associated challenges that get involved like attention and organizational skills, learning challenges or disabilities, relationships with peers, teachers, dating, siblings, and again, revisiting self-esteem and self-confidence. We don't want these kids, in their teenage years getting depressed, down on themselves, thinking there's something wrong with them or that they're defective in some way. I'm a big proponent from a very early age in getting it into their head that their mind works differently, and it's not an inferior mind by any stretch. Everyone's different, and what they do well, they can do much better than many other kids, and really helping them build their self-esteem and self-confidence. So your homework, mom, dad, caregiver, take this little worksheet and fill out your top 3 strengths of your child, where you're going to use those to help bolster some of their weaknesses, and your top 3 current challenges of all the ones I've mentioned, which are the ones that right now you want to address, so that you can move along through this program effectively and pick and choose what's the most important for you. For more, please do check back. We're going to start with a couple modules, but we're going to continually add new ones, because the topic, this domain of high-functioning autism spectrum disorder has such a wide stretch. And so please, please, please give me feedback, questions, and suggestions for new topics at howtohelpmychild.com. Thank you very much for listening, and I'm really excited about getting started with you and your child.